Hey, this is Dr. William Song from Omni Aesthetics. Today, let's talk about AutoCorre. AutoCorre is one of my favorite topics to talk about because this is a protocol that we came up with right here at Omni Aesthetics. The name comes from autocorrect, and that's because that's what it actually does. It's kind of an autocorrect system for your face and your skin. So let me back up and tell you how we came up with this process. As you know, we've been doing all the typical treatments like fillers and threads and biostimulators, and we work with PRP and stem cells and fat. So we have a lot of experience with anti-aging. And over the past 15 years, I've been tweaking the different treatments that we have and combining them together and trying to find the best of each treatment. And over the process, I've come up with a series of protocols for treating different things that bother people the most. So let's start with the pure AutoCorre. AutoCorre is a way that we take your blood and we extract plasma from your blood, and we can take that plasma, put it through a centrifuge, and separate the different components of your blood. So your blood is composed of water and proteins, red blood cells, white blood cells, and a lot of growth factors. And platelets are where most of the growth factors are stored. So we concentrate on the platelets, and that's where the PRP and PRF comes in handy. So what I decided to do was take the different components of the blood, extract the platelets from the plasma. And one of the things we do with AutoCorre is we take the part of the plasma that we would normally discard, that's mostly water and proteins, and we gently heat it to turn it into a gel. And when we do that, we can let it cool and mix it with a very concentrated PRP so that the growth factors are embedded in the gel that we create. And by doing this, we could treat areas that are very sensitive, like under the eyes. So that's the first protocol that we came up with, where we don't want to use fillers because under the eyes, the fillers can cause some problems. Like sometimes it could look swollen, sometimes you can get lumps and discoloration. So the AutoCorre for under eyes is using your plasma with platelets and a gel created from your plasma. So when we inject it, we allow those growth factors to slowly be released, and it'll slowly correct under your eyes, the crepey skin, and even provide some volume there. Now you do get some instant results, and to be perfectly honest, a lot of that is from swelling and will go down. But the real magic happens over time when the growth factors stimulate your own collagen production and even stimulates the fat pad that are under the eyes. And you'll get a slow rejuvenation to restore the area under your eyes to the way it was when you were much younger. And what we found with the patients that we've been treating over the years is that each year they keep getting better. The treatments tend to be cumulative so that as you're aging, instead of looking older, you're actually looking younger. So that is our AutoCorre for under the eyes. That's one of our most popular treatments. The other AutoCorre treatment that we love doing and that works so well is our AutoCorre HD treatment. With the AutoCorre HD, we do mix it with a little bit of filler. And what we do with that is we use a technique called hyperdilute, where we dilute out the filler. We use a hyaluronic acid filler. We dilute it out so it's really thin, so we can inject it very superficially into the skin, into those little fine lines like the smoker's line, the lines around your mouth, and even the nasolabial folds. Those are lines that are very difficult to get because there's a lot of movement around the mouth, and a lot of times people find that that area looks a lot older than the rest of your face, especially if you're doing other treatments like Botox and fillers and lasers around the face. This area is difficult to treat. But when we use a hyperdilute technique, we can inject a filler very superficially without getting the lumpies. And we combine that with your own plasma with the PRF. And when we do that, the filler acts as a scaffold for your collagen to form around. Because when we inject the PRP with the fillers, the platelets stick to the filler and then they release a signal slowly over time to allow your own collagen to come in and start filling those little fine lines and rejuvenating your skin. So with this treatment, you'll get some instant results, and it keeps getting better over time. And each time you do it, it is cumulative. So you will continue to get better. So we have people out now like 10 years. And when you look at their pictures today versus what they looked like 10 years ago, they actually look younger now than they did back then. And if you look at the series of pictures, they keep getting better. And that's what's really fun to see. There are other treatments that we've used to try to get this type of effect, mainly like deep peels and laser treatments. And those are effective, but there's downtime involved with it. If you want to get a good result with laser, you really have to do pretty aggressive treatment, and you can have 2, 3, 4 weeks of downtime with that. Whereas with this treatment, it's usually just a couple of days, a little bit of swelling and possible bruising. And I think the results are actually better. And you can look at our pictures and judge for yourself. But these are our two most popular AutoCorre treatments. And we also have variations of it where we can replace the volume loss in your temples and your jawline. And we have body treatments for it as well. So that is our AutoCorre treatment. AutoCorre is mostly all natural. You can do it without any fillers, or if we use a little bit of filler, it does help the longevity of it. The key is we don't have to use a lot of fillers. When we used to treat people for volume loss with fillers to do a complete like facial rejuvenation, we used to have to use like 5, even 10 syringes of fillers. Now, with the AutoCorre technique, I would use like 1 or 2 syringes of filler and combine that with your own plasma so that most of the volume that you get is from your own collagen and your own fat being rejuvenated. So that's the beauty of AutoCorre. It's a very natural treatment where you'll look natural, not overdone, very little downtime, and we can do a full correction of your face with AutoCorre. I'm Dr. William Song. If you have any questions about AutoCorre or would like to find out more, please give us a call, 201-368-3800, and we'd be happy to talk to you about it. Yeah, you have some questions?
Yes, we have a bunch of great
Oh,
questions.
awesome.
So let's start off with, how does AutoCorre compare to collagen stimulators like Sculptra? And there's other fillers like Bellafill and Radias. How does AutoCorre compare to those?
So we started off with regular fillers, and hyaluronic acid was the most popular filler because hyaluronic acid is a substance that's normally present in our body, and we used it to replace volume loss. Now, the problem with regular fillers was that if you put too much, it does start to look unnatural, and now we're finding that we're having to dissolve them. So the collagen stimulators came along where we use a substance like, for example, Sculptra is basically absorbable sutures that have been ground up into a powder and then dissolved in water. And then if we inject that under your skin, we find that just by gently irritating the skin underneath, you'll produce collagen because the body wants to heal. And we discovered that when surgeons go in after somebody's had previous surgery and they've had dissolvable sutures placed during surgery, we find that the sutures have dissolved away as they're supposed to, but we find that there is collagen formation around where the sutures were. So that concept took us to grinding up the sutures and placing it in the skin to create that collagen production. So that's how a product like Sculptra works. And a product like Bellafill actually uses an implant material, microscopic implant material that stays there. It doesn't dissolve away, but your collagen forms around it. So that's more permanent. So this is how we were able to get a more natural look than fillers because it's mostly your own collagen that cause the stimulation of collagen. Now, the way we stimulate collagen is by causing irritation. and forcing your body to send a signal to heal. So what if we did not have to injure the skin and we can just harness the healing signal? It turns out we can do that, and that's where the PRP comes in. Your platelets are the first responders when you have an injury. So if you place a product like Sculptra or Bellafill or Radias, your platelets are going to come and kind of adhere to the foreign substance, and then they're going to start releasing a signal from the growth factors telling your collagen and stem cells to come and start making new skin and new collagen. So that's how the collagen stimulators work. So if it's the platelets that's where the signals are coming from, what if we just took the platelets out of your blood, concentrated it, and then injected right into those areas that we want stimulation? And that's how PRP works. We take concentrated platelets and put it into the area. And that's a great concept. The problem with using PRP in that way is that the PRP did not stay. It just kind of dissipated. So that's where the AutoCorre comes in. We're using your plasma gel or a little bit of filler to keep the platelets where we want it so it can send out the signal. And we're sending out a much more robust signal than you would with the collagen stimulators. So that's how this differs from the collagen stimulators.
Awesome. That was a great explanation. So now with the AutoCorre HD, you spoke about using AutoCorre in combination with hyperdilute hyaluronic acid fillers. How does traditional like hyaluronic acid fillers compare or differentiate from AutoCorre HD?
So in the past, when we tried to fill in a line like the nasolabial folds here, what we did was we put the hyaluronic acid filler in with the needle underneath the skin to try to push that line up. And that'll soften the line. The problem with doing it that way is that it doesn't look quite natural because you're trying to push up that line instead of spreading it out. And because you're putting a bolus of filler underneath there in an area where there's a lot of motion, the fillers are going to move, and that's migration. And you hear about migration of fillers, and where do they go? The fillers, due to gravity, will migrate down, and then you start to get like a fullness in the jowls, and that's not a good look. So that's why when we hyperdilute the filler, we're really diluting it out because we're not trying to push anything out. We're just creating a scaffold. So when it's diluted, I can put the fillers right into those lines on the surface of the skin. And because it's not going under the skin, it's going in the skin. It'll kind of dissipate a little bit because we want that so we get a smooth appearance, but it's not going to move away from where we inject it. It's going to stay in that general vicinity and integrate into the skin. So that's how this technique differs from what we used to do with fillers.
So what can patients expect during recovery from AutoCorre HD? Because we're actually finding that some of these results are actually better than doing laser resurfacing, which a lot of people know is a lot of downtime. So what kind of downtime can you expect with AutoCorre HD?
So with the AutoCorre HD, we're using real tiny, tiny needles, even smaller than what we use to inject Botox with. Because the needles are so tiny and we inject right under the surface of the skin, you're not going to have a lot of bleeding or bruising. Sometimes you could get little tiny bruises around where we inject, but because it's so superficial, the bruising usually goes away within a couple of days. So you don't have the risk of getting those deep bruises that last for weeks. And the uh, the other thing you might see is like a little lumps, little bumpiness where we inject it. but that's okay because it is hyperdiluted and it's so thin, it integrates into the skin and just smooths out. So after 24 or 48 hours, you look like you had nothing done except minus the wrinkles, because you do get some instant results with it, which just keeps getting better.
Great. And a question I hear all the time is people asking who are a little bit older, they say, is it going to work on me because my collagen has kind of slowed down? Is that something that affects the AutoCore treatment?
It is true that as we get older, we're not going to be able to produce collagen as well as when we were younger. But the fact of the matter is that we need this more as we get older because when we're young, we don't need it as much. So when we do start to develop those lines, we can inject those and stimulate the collagen, and you will, as long as you're taking care of yourself, not smoking, spending all your time out in the sun, your body will continue to make collagen throughout your life. So it's going to work at any age. And once you do start developing those lines, if you're like over 40 and you start developing those lines, the sooner you start, the more time you have to repair. If those lines are really creased in, then it's going to take more treatments and it's going to take longer to get the results that we want. And one thing about this treatment is like we don't want to overdo it because remember, the fillers are just acting as a scaffold and we're relying on your collagen forming around it. So by putting more fillers in and doing it more often is not going to speed up the results. It's just going to put more fillers in your face, in which case we're kind of back to what we used to be doing is filling with fillers. Whereas with this, we're just stimulating your collagen. So over time, and we're talking like over years, it's going to just keep getting better and better each time you do it. So most of our clients will do a treatment every 6 months or once a year. That's typically how often they do it, depending on the condition of the skin. So we don't really recommend doing it more frequently than that. And you can always do other areas with it, but in that same area, we recommend about 6 to 12 months between treatments.
And then just the last question. Are fillers, like traditional fillers, becoming outdated? Do you think that like the world of aesthetics is moving towards more regenerative treatments?
I think the way we used to do fillers is outdated. And unfortunately, a lot of injectors still use the techniques that they learned 10, 15 years ago. And some people are still teaching the techniques that we used to do 10, 15 years ago. And I think that really needs to change because we know so much more now and we have much better ways to use these tools, and that's what they are. The fillers, injectables, lasers, they're all tools, and we're constantly learning better ways to use this because what we're trying to do is to find ways to give you the most natural look to help you look the best that you can at your present age.